But first up tonight, the crisis in Australia looming over aged care places, with predictions now included in a story in the Australian today suggesting the sector is facing a nursing shortfall of 8,100 nurses over the next 12 months. Now, this crisis isn't off in the distance. It's already here. And that piece today predicted one in five public aged care beds will be forced to close in Victoria alone. Now, I mentioned this again after last night talking on this program with Lou Pascuzzi, who owns TLC Aged Care, which is the largest family-owned operator in the state of Victoria. He laid out for us the crippling cost of increases of everything from electricity to payroll tax, laundry and wages costs. Now, today we learn another challenge, new reforms, including what I mentioned last night, 24/7 nurses and minimum care requirements for public aged care in Victoria. Now, as an operator, you're required to have one registered nurse per 7 residents in the morning, 8 in the afternoon, and 15 nurses at night. Now, quite simply, if operators are to abide by those numbers, and even if they desperately want to do the right thing, they can't, because the nurses don't exist. There's no nurses around to put in those places. Now, given the pay and conditions, nurses can go and work elsewhere and earn more and not have to deal with the emotionally draining job of aged care. These rules have led, according to industry insiders reported in the Australian today, that 20%, so 20 in every 100 beds in Victoria in aged care are empty. Now, to put that in context, of the 5,300 public aged care beds available, 1,200 are empty because operators can't find staff to operate them. And what do you reckon the knock-on effect of that is? Well, I'll tell you what it is. Elderly Australians needing out-of-home aged care are being forced to admit themselves to overcrowded public hospitals with non-acute conditions. And as Jess Malcolm reports in the Australian, that clogs up the healthcare system, leading to shortages of acute care beds that should be set aside for elective surgery. So that's the reality. It might be a good line to toss out during a hard-fought election campaign, eliciting a cheer from the crowd. You know how it went. We promise a nurse in every aged care home 24/7 and we will deliver. Well, it was never going to happen because there's not enough nurses. COVID showed us that. And now it's causing clogged up hospitals, delaying much-needed elective surgery and shutting down aged care beds. Perhaps the new government in Canberra and their Labor mates running Victoria and the other states might like to explain how they will fix this urgent problem, or not.